Results from the Moderna and Pfizer-BioNTech vaccines were recently published in the New England Journal of Medicine. Both have had very similar impressive results and, as you would be aware, are approved in the US and other countries. Today I'll be talking about the results from the Moderna trial. So down to the details. So what this vaccine involves is 2 doses of a 0.5 ml injection containing mRNA expressing the virus spike protein, and the doses are given 28 days apart. The injections given in the deltoid, or basically the shoulder arm, as is standard for many vaccines, and this was a placebo randomized control trial, and the placebo group had an injection of the same volume of saline. So the study design involved 30,000 participants across over 90 sites in the US, and they were divided equally between both the vaccine arm and the placebo. And overall, there was very good follow-up across the 2 doses required for the vaccine, with less than 10% of people kind of been dropping out through the study. The main primary endpoint for this study was to look at the rate of occurrence of COVID within 14 days of the second injection. That is basically after 14 days of the second injection. And this was defined as either having 2 symptoms related to COVID, such as fever, aches, sore throat, loss of taste, or a range of other respiratory symptoms, and having a positive swab. The secondary endpoint, which they also looked at, was the prevention of severe COVID, which is basically defined as requiring high-level hospital care and marked by having basically high heart rate, low oxygen levels, and low blood pressure and other markers of severe illness. One of the issues with this, which we'll come back to, is that this does not, neither of these outcomes really captures asymptomatic transmission, and so it does limit our ability to determine how well this will prevent the spread of the disease. So overall, the characteristics of the people involved in this study are described here. The main take-home messages are that people from a range of age groups, 18 to 95, were included in the study, and both those who are classified as being high risk, so those with illnesses such as diabetes, having high body weight, or being immunocompromised, as well as those not at high risk, were included in the study. And a range of ethnicities were included, but predominantly people with white ethnicity. So before getting to the results, it's worth just looking at the adverse events, which is often a concern for many people. And the bottom line is the vaccine is very safe. So the adverse effects seen in this, so the first one shows local adverse effects, so this includes pain or redness at the injection site. And what the grading reflects is the severity, so grade 1 being very minor, not needing any attention, grade 2 being mild symptoms which might need a bit of kind of over-the-counter pain relief for a day, and grade 3 being a bit more severe, where you may get a prescription for, or see a local doctor for something a bit more, for example, prescription pain relief. And there was no serious side effects, which are classified as grade 4, which requires presentation either to emergency department or hospitalization. So we can say that there's no serious adverse effects from this vaccine. And in terms of looking at systemic side effects, for many of these, the vaccine and placebo were fairly comparable, and so I think the bottom line is it's kind of very similar to any other vaccine in terms of side effect profile, that you can expect to get some pain at the injection site, and potentially there might be slightly higher perhaps aches, some kind of aches and fatigue-like symptoms, but these are fairly mild and not long-lasting. Getting to the efficacy of the vaccine, as you probably are aware by now, the vaccine is very effective at preventing new infections, with overall, by the predefined analysis, having 94% efficacy in preventing an infection. So in the placebo group, there was 56.5 infections per 1,000 people when extrapolated over a 12-month period, and the vaccine group there was only 3.3. And when you look at the number of severe cases, there was 30 in the placebo group and none in the vaccine group. And this is going to be predominantly driven by the fact that there were very few cases of COVID in the placebo, in the vaccine group, I should say. So we can't really determine from this data alone whether, if you do get COVID after the vaccine, whether it's less severe or not. But because it's so effective at preventing the COVID, your chance of getting severe illness, which is what we're most worried about, is very, very low if you get the vaccine. So what's the take-home messages from this paper is, is this vaccine safe? Yes, it's safe. And many people, including myself, had concerns about rare side effects, which this trial is obviously not going to have enough people to detect, where you may need 100,000 people or more to detect potential rare side effects. But the reality is the risk of any rare side effect from the vaccine is much lower than the risk of a serious complication from COVID itself. So it's really not something to be worried about. So I think we can say that this vaccine is safe to take. And is it effective? Yes, it's very effective, at least in the short period of the study, which was a kind of 3-month period. And the question which remains is, will this provide long-term protection? And this is where, unfortunately, it's too early to tell. And I mean, based on these results, it is very promising that this should be able to bring COVID under control. The two things, I guess, to be aware of would be, one, that perhaps the body's immune response following the vaccine is not long-lasting, so you may need further booster doses or revaccination to maintain that response. The second potential problem, which may mean that long-term control is not established, is that if the virus mutates to a variant which is no longer protected by the virus, and at that point it would be a guessing game as to whether it may reduce maybe the severity of a new variant. And so we really don't have enough information to say anything meaningful about this possibility. The only thing worth noting about the study is that since the study has been done in many areas, the infection rates have increased further. So in this study, based on the data, they showed approximately 1 in 1,000 per day. The infection rates were something like 1 in 10,000. At the moment, in places where there's high rates of infection, it's something like 1 in 1,000 people are getting into an infection every day. So, and the reason this is of concern is when there's more virus going around at the same time a vaccine, there's theoretically increased chance of the virus mutating to become perhaps resistant to the vaccine, if that is possible. So, I mean, ultimately time will tell, and hopefully this isn't something we need to be worried about.